Okay, so I've been asked to present today just a very quick explanation of the Soma approach to what we refer to as clinical massage therapy versus what is typically out there in the industry today. So the first thing that you want to be aware of is the industry typically teaches their massage therapists to do full body massage. There's not a huge focus on one specific area of pain, discomfort, dysfunction. And that's one of the approaches that Soma wants to look at differently. We're going to try and take, instead of doing a full body approach on a regular basis, we're first going to bring the client in. We're going to do what's known as an assessment process with them, just like if they were to go to a medical clinic. They come in with their complaints, the nurse would come in and start to do a series of questionings to try and help the doctor figure out what's going on. In our particular case, what we'll do is we'll try and follow that same approach. So as they come in, we'll take the clinical approach, which is to start asking them specific questions related to what's going on with their body, what brought them in that day. If they came in with some kind of a specific regional condition, for example, shoulder pain, low back pain, knee pain, or whatever, then there is a series of questions the students would be taught that helps them learn better how to approach that region and then take from a very broad range and narrow it down to what's a very good chance as to what's going on with the client. In some cases, the problem can be simple for the massage therapist to deal with. Then they sit down and progress from the assessment process to the treatment process. In other cases, the assessment process is done and it's determined that the condition that the client has isn't appropriate to be receiving massage. So there are times when we do need to take the massage client and refer them to a general practitioner who can then do a more thorough assessment and determine next course of action. So we're really trying to help the students understand here's the way the client is presenting, and then help them narrow down the condition the client might be presenting with, and then build their approach to it. So a couple other things that we want to make sure that you're aware of from a clinical standpoint. We are very condition specific. Condition specific means as the client comes in and starts telling us about their symptoms, we know there are certain medical conditions that they may be suffering from. And though the massage therapist is not allowed to diagnose, we can do some testing through the assessment process to see if that specific condition is present. Now, in some cases, clinical conditions or medical conditions can actually be the result of other situations. For example, somebody might sprain a muscle in their back, and as a result, they start to get a herniated disc. In our particular case, what we're going to do is look at the components of that condition which can be helped by working on the soft tissue. So the massage therapist does what they specialize in, soft tissue work. So if the client has a condition, we're going to do as much as we can and teach the student to do as much as they can with that condition within the appropriate scope of practice for a massage therapist. So if it is carpal tunnel syndrome, for example, I know that the nerve is going to be impinged upon within the carpal tunnel space. But that impingement can also be affected by muscles in the forearm, muscles in the upper arm, muscles in the shoulders, and possibly even in the neck. And if I can get those particular regions to relax and return to normal function, there's a very good chance that the carpal tunnel syndrome problem can then resolve itself because these contributing factors have been taken care of. So that's what we mean by specific condition. We figure out through the assessment process what might be their problem. Once we've done the assessment problem, then we can plan a specific treatment. And once we've planned the treatment, we implement the treatment, and then we reassess to make sure that what we're doing actually works. The third thing that we want to make sure that the student is aware of is there's a specific timing. So in a lot of chiropractic offices or medical offices or PT offices, their treatments are based on a very specific time frame. Insurance industry says you have X number of minutes to complete a treatment, and at that point you bill for a certain amount. So we also try and make sure the students are trained very specifically in you have a 30-minute time increment to do your regional treatment. With full body treatments, a lot of times the treatment is an hour in length. But the billing process in the chiropractic doesn't often fit that model. So we want to make sure that the students are capable of working in a 30-minute time frame, so a lot of treatment development is geared toward that 30-minute treatment protocol. And then the last thing we do quite a bit of is we not only want to make sure the students are proficient in the Swedish massage techniques, the effleurage, petrissage, tapotement, compression, and friction, but we also want to make sure that they are also introduced to and understand the concepts of other more advanced techniques, such as myofascial techniques, such as a clearing or deep transverse friction technique, manual lymphatic drainage, and some of the more specifics of sports massage. So those treatment protocols are introduced to the students, and then they get the idea of how those concepts can be built into a specific clinical treatment. Once the students have learned all of that, it starts out in the program where we start with a very broad-based approach, give them some of the assessment tools, we give them some of the pathology problems, the physiology, the anatomy, but by the end of the program we gear everything in so they have a very good frame of reference on how to listen to what the client tells them, and then based on what the client tells them as they come in, we want them to be able to formulate an assessment process. We want them to implement a treatment protocol. We want them to be able to reassess to make sure the treatment protocol is working. And then we want to give them a good frame of reference on how to build for future treatments. So once the client is healthy, we can keep them that way. That's the approach that Soma wants to take, and that if you come here, we're going to build upon.